And how do I maintain weight loss after stopping medication?
It's a very important question because obviously, with the use of medication, with the government's covering now, insurance covering now. And so I just want to set the stage first about these medications, right? Remember, right now, the Canadian Medical Association defines obesity as a disease, right? The World Health Organization defined obesity as a disease. Yes, there's lifestyle, there's genetic, there's lots of components to it. But nonetheless, it's a disease. There are good treatments for it with medication. And so it really boils down to where you're at and how much you're using in terms of medication, right? And so if you are at a higher dose, let's say the maximum dose of the medication, it is going to be a lot more difficult to come off the medication, right? Because what's the purpose? It's suppressing appetite, hunger, and craving. And so if you require less medication overall in your journey, then you likely would require two things. Either you're a super responder to the medication, meaning that it has a profound effect on you in terms of suppressing the hunger and appetite, or you're displaying more discipline, more commitment, all the values that we put into the reason why we're wanting to change our weight, right? And so as you're exhibiting that and practicing that throughout your journey, the things that we do becomes more habitual. And that's the other thing. So one of the things that you want to do is your daily healthy habits that you do has to be habitual, meaning that it's a reflex. Certain things you won't eat, certain things you eat, the amount of food you eat, the times you're exercising, all these things has to be habitual. And there's studies that showed that when you do something, it takes about 26 to 266 times. That's roughly 1 month to about 8 months, 9 months in order for it to be habitual. The mean is about 66 or something like the average. And so you can expect up to several months, a minimum of 3 months before things becoming habitual, and really to have the best chance of coming up with medication, all the healthy habits, healthy behaviors you do has to be habitual, right? Now, the other thing is the longer you are at a certain weight, the more steady you are, the more you allow your hormones to equilibrate over time. So your hunger hormones, your all the ones that make you want to eat, the hormones that make you want to feel full, the lifestyle you're doing, the energy requirement that you need, the body gets really used to it. It's not a shock to the system when you go from like 2,500 calories to 1,500 calories per se, And so if you can stay on the medication for about 3 to 5 years, right? Let's say, because the studies that we have are up to 5 years, that it shows that your weight regain tends to be a lot slower. I'm not saying you just stay the same weight. Nobody stays at the exact same weight. So that's one of the things you have to understand. That it always fluctuates. Do you fluctuate sideways, or you fluctuate upwards, or you fluctuate downwards too as well, right? And so the longer you stay at a certain weight, you're more likely to come off the medication and maintain it longer. So that the body's drive, you have to remember, and it's physiological survival, Darwin's kind of survival of the fittest, is that the body will want to go back to its highest weight. This is called the memory weight too as well, right? And so that drive to go back to the weight diminishes over time. So after, a year, 2 year, 3 year, two as well. So if you're able to combine that. Now, the other thing is, if you're on a bigger dose of medication, you want to maybe just taper it down over time rather than stopping it abruptly. When you stop it abruptly at a higher dose versus a lower dose, you're going to appreciate that rebound kind of hunger and rebound desire to eat too as well. As a matter of fact, if you were to lose weight and you were successful without medication, something subconsciously happens to us after several months, maybe 3 months, 6 months. And what happens is that we start to subconsciously take more food than we actually realize, actually. And so the spoon is a little bigger and everything. We tend to eat a little more. And as you start to refeed the body with a little more fuel in terms of like food, we tend to regress to our old behaviors too as well. Remember, with these behavioral changes that we do, we're creating new kind of connections, right? And so, for example, if you walk down a path in the woods and you've trodden down and people have trod down that one path for many, many years, you see a nice delineated path, that's dirt, and then there's like shrubs on the sides and stuff like that. But what happens is that, let's say you create a new behavior, you create a new connection, right? And let's say, the behavior is you're not eating after 8 o'clock. So what happens is that, well, you create this new behavior, but that old behavior never disappears. But over time, what happens? It's the grass and the shrubs and all the weeds starts to grow over it. But if you look at it carefully, you still make out, oh, that used to be a path that people go down, right? And that's what happens to our brain, right? And so that now you develop this new path, right? And it's it's deeper, you're seeing it more, you're doing it every day. The groove is deeper, and it's become habitual. So now there's this new beautiful path that you've made, that you've done. So what happens? Sometimes we cave in. We see food on the counter, and we have one piece. Ooh, that's great. One. It's like that old flame that we had, like all the memories and the feelings come back. And so then what happens is then we have a higher propensity to fall back. And that's that kind of dopamine release that we have that occurs with the things that we do habitually too as well, right? And so then you come back to it. But tracking your behaviors, minimizing your environment can reduce those chances from happening. It's not about being perfect. It's about, going back to going back to your new ways from your old ways that you reverted back to once in a while, right? So nobody's going to be perfect. The last thing is, as Sam mentioned, the values that we're doing, the values that why you're doing what you're doing, getting deeper into the whys, the fifth level, the sixth level of the whys. The more you get into that, the more you will likely have better resilience and discipline. And I'll tell you a story from a medical perspective. And so I'm a respirologist, and people smoke. We diagnose cancer pretty much every week. And I remember a patient that told me that she was diagnosed with cancer, but she came to see me back, and she's like, she quit smoking. And she got her diagnosis from the medical oncologist. And so what happened was her hands were in her pocket, her smokes were in her pocket, and the oncologist gives her, the news that this is cancer, blah, 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 and says to her, well, this is kind of the time frame, this is the prognosis. As soon as she heard that, she just crushed the cigarettes in her hand, in her pocket, takes it out, throws it in the garbage. And it's that mental switch that people make. And because, it's not that she hasn't tried to quit many, many years ago. She did so many times. She just, wasn't successful, but there was enough leverage, whatever was in her, that she wanted to live longer, whatever reason, that she decided to make the mental switch, right? And so if sometimes we require something catastrophic to make us do that, a motor vehicle accident, a bad illness. But a lot of times there are more subtle signs. We are diagnosed with pre-diabetes. We have early fatty liver disease, a short of breath when we're walking upstairs. These type of things. And so asking your whys when you have these symptoms per se, and going through that fifth, sixth level of whys will give you more resolve, discipline, grit, all the things, all the virtues we need in order to have that resolute kind of discipline to, we go back to the good behaviors that we want to do too as well. So there is no one best way to do it, Samantha. As a practitioner, I always try to use the lowest dose as much as possible for our patients, so that we know that, nobody likes to take medication. We know that, including myself. I try to heal without medication, but sometimes you do need it. And I think if you are at a heavier weight, it is always going to be a little harder to come off the medication. And there are individuals who I've seen in my practice that were very heavy, lost over 100 pounds, and have been able to come off the medication and stay off the medication. And I think the defining difference for these individuals is that commitment they made to themselves, that value that they've made to themselves, that there's no wavering from that. And the last thing I want to say is that if you leave your past behind more and more and more, and what do I mean by that? Well, just pretend you're driving and look in the rearview mirror. The more you drive forward, i.e., the more goals you have, the more you elevate your standards, right? The less likely you will be able to revert back to where you were. The more you raise your standard, right, the better your identity. And so obviously we're talking about weight and health here, is that how healthy do you want to be? So you've lost 100 pounds, you've lost that 50 pounds, then what?